I'm John. I live in Mesa, Arizona, but prior to that, I lived in Sitka, Alaska, which is an island 100 miles out in the ocean, 8,000 people. Everybody knew everybody. I have twin boys who still live there and a daughter who is a registered nurse in Northern California. I love the outdoors. I love catching fish. And the indigenous people I felt very close to. It was a wonderful life up there. 10 years ago, when I was first diagnosed with prostate cancer, I was scared to death. I just didn't know which way to jump or what to do. So my first 4 or 5 months were really soul searching, gathering as much information about what my potential treatments might be. And I went in for the surgery. I went back to work. I was with my family. Everything was just wonderful for 2 more years until my PSA started to increase and my cancer was back. And this time it came back with a vengeance. It was time for me to make a complete lifestyle change, and that was to face retirement and get closer to where I could get the medical attention I needed. It was not available on the island. This is going to be the battle of my life. My oncologist was able to sit down with me and say, I'm not sugarcoating any of this, John. You may have 3 to 5 years to live. That was 7 years ago. Since I started Rubraca, there's been almost no detection of the cancer in my body. It's 2 pills that I take in the morning and 2 pills at night, approximately 12 hours apart. I have experienced a number of the side effects that are common with the drug. Every morning when you get up, it's a choice that you make. You can either dwell on the dark side of what your potential could be, of the fact that there isn't truly a full cure for what I have, or you can dwell on the fact that it's a beautiful day, the sun's shining. I'm going to make it the best day that I possibly can. And I've always been that cup half full kind of person. No matter who I speak to, I always tell them how blessed I am. Rubraca has worked very well for me. It has given me great hope.
What is Rubraca used for? Rubraca, rucaparib tablets, are a prescription medicine used in adults for the treatment of castration-resistant prostate cancer that no longer responds to medical or surgical treatment that lowers testosterone, that has spread to other parts of the body, and has a certain type of inherited germline or acquired somatic abnormal BRCA gene, and you have been treated with certain medicines for your cancer. Rubraca was approved based on response rate and how long patients' responses lasted. There are ongoing studies to confirm the clinical benefit of Rubraca. Your healthcare provider will perform a test to make sure Rubraca is right for you. It is not known if Rubraca is safe and effective in children. What warnings should I know about Rubraca? Rubraca tablets may cause serious side effects, including bone marrow problems called Myelodysplastic Syndrome, MDS, or a type of cancer of the blood called Acute Myeloid Leukemia, AML. Some people who have ovarian cancer and who have received previous treatment with chemotherapy or certain other medicines for their cancer have developed MDS or AML during or after treatment with Rubraca. Although MDS or AML was not observed in men with prostate cancer during the clinical study, MDS or AML may lead to death. If you develop MDS or AML, your healthcare provider will stop treatment with Rubraca. If you are a male with a female partner who is pregnant or able to become pregnant, effective birth control should be used during treatment and for 3 months after the last dose of Rubraca. Do not donate sperm during use and for 3 months after the last dose of Rubraca. What other important information should I know about Rubraca? Your healthcare provider will do blood tests before and every month during treatment with Rubraca to monitor your blood cell counts. Weekly blood tests will be performed if you have low blood cell counts for a long time. Your healthcare provider may stop treatment with Rubraca until your blood cell counts improve. Avoid spending time in sunlight while on Rubraca, since your skin may become more sensitive to the sun and may sunburn more easily. You should wear a hat and clothes that cover your skin and use sunscreen to help protect against sunburn if you have to be in the sunlight. What are the side effects of Rubraca? The most common side effects for men in Rubraca clinical studies were weakness, fatigue, nausea, decreased red blood cell count, changes in liver function tests, decreased appetite, constipation, rash, decreased platelet count, vomiting, and diarrhea. What other medications might interact with Rubraca? Rubraca can increase the amounts of other medications you may be taking, which can increase the risk of side effects. Tell your healthcare provider about all of your medical conditions and all medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. You may report side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. You may also report side effects to Clovis Oncology Incorporated at 1-415-409-7220 U.S. toll or 1-844-258-7662 U.S. toll-free. Please see full prescribing information, including patient information, for additional important safety information.